Interface Video, in cooperation with Fairfield Federal, presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fairhope Hospice and Palliative Care, the Frankie Smith Funeral Home, Fairfield County Adam H., Dagger Law, and the Fairfield County Board of Developmental Disabilities.
Hello friends, and welcome to Fairfield Today. Paul Jasson with you, and of course downtown in the spacious lobby of Fairfield Federal here. It's a pleasure to have you with us. Might mention in the second half of the show today, actually a pretty timely interview with Joe Ebel. Joe is the Fairfield County Health Commissioner. We'll be talking obviously about COVID things, all things related to Lancaster and Fairfield County. So Joe will be on in the second half of the show. But the first half, pleasure to have with us, and oddly enough, we just got to chat with her a little bit at the festival, Lancaster Festival, which ended a couple weeks ago. Kristin Glasure. Kristin is the CEO of Fairhope Hospice. Kristin, welcome back.
Thank you, Paul.
And you're still the CEO.
I am still the CEO.
No changes there. No changes. And how long have you been the CEO now?
July 17th.
Wow. Pretty quick.
Pretty quick.
Replaced Denise Bauer, who retired, and big shoes to fill there.
Absolutely.
She'd been there a long time. When I first knew her, she was just a nurse that was working there, and just as she moved up, but done a tremendous job there. How long have you been connected to Fairhope Hospice?
So I've been with Fairhope for 5 years.
Okay.
There's a little story behind that.
Okay.
So years ago, many years ago, 30, when I graduated from college, I'm a social worker, and I started with Fairhope then.
Mm-hmm.
So I worked as a social worker. I made visits to patients and helped with the volunteer program, helped build that and train them. And then also I did some bereavement with families.
Mm-hmm.
So it was much smaller then. We had 30 patients, and I was there for about 6 years.
Were you at the location out here on East Main?
Yes.
When they were,
yes.
That's when I first got to know them, when they were right there.
Yeah, and actually it's funny because we started in, if you remember, on the corner there of East Main, there was the visiting nurses.
Yes.
And also like a little Dairy Mart. So we had a little corner in one of those buildings. And then we moved to the office that was on East Main Street. So that was many years ago.
Yeah. And look where you are now.
I know.
So you were there then.
I was there then.
And?
I worked there for about 6 years, and then kind of went on and tried some other jobs
Spread
as a
your
social
wings
worker.
A little bit.
Gained a little knowledge.
Sure.
And some experience. And so about 5 years ago, Denise called, and she said, Kristin, we're growing. We really could use a supervisor for the social workers. So I came back, and I was the supervisor for our social work team, our chaplain team, and then they added the bereavement team. I moved up to the leadership position, and then about 2.5 years ago, the board and Denise asked me to take over as vice president. So I've been the vice president for the past 2.5 years, kind of preparing for this time, really.
Getting your feet wet a little bit, seeing how the decisions are made, and more of the inner workings.
Right.
So now we ascend to the top position. How many employees do you now have at Fairhope Hospice?
So we have about 130 employees.
Wow. And volunteers?
Just about the same.
Wow.
Yeah. And if you think about it, we had a census when I worked there back in the 90s of about 30 patients. Right now we carry anywhere from 140, 150 or more sometimes. So, everything's really growing.
I can remember when I first, and again, you were down there on East Main Street, and I can remember when I first started hearing about it. I didn't know much about it, frankly. Thankfully, I hadn't had anybody that had needed that service yet, so I was learning about it. But they started talking about, well, it's end of life care, and it took me a while to kind of grasp that. But really, that's what it's all about: to take someone who is at the end of their time when they've been given that word, and you do, if you're called in to help, you do everything, I would say almost humanly possible, to make this time as good as it could be.
Absolutely. It's interesting. I'm glad you kind of brought that up, because when people think about hospice and Fairhope, they do think of end of life. But what's really important is, in order for someone to be appropriate for hospice, their life expectancy would be 6 months or less.
Yes.
But what we really work with and really try to let the public know is that we want that to be good quality time. So sometimes people are with us on service for 2 days, 2 months, 6 months, even longer sometimes. And once we see sometimes that once we get patients comfortable and help them with some of the psychological and just spiritual and just physical needs, they seem to kind of relax and their quality of life is greatly improved.
Well, it's amazing, again, the stories that I've heard and seen personally, and other people have told me about what's going on. I've talked many times in your chair. Rick Schneider would be joining us, who just recently retired, and the things that your organization does to make this quality of life care at the end as good as it can be. And really, it's if you're up there, for example, in your building out there up off of Sells Road up there, really the sky's the limit. You just do whatever the family or the person wants.
It is. Of course, we see patients in the community. We service communities all surrounding Fairfield County within about an hour from our office in Pickering House on Sells Road. So we do a lot of good work in the home and nursing homes. And then at the Pickering House is where we can bring those patients who maybe have a symptom that we can't get managed at home. We can't maybe get them comfortable at home. Maybe there's some dynamics at home. Maybe the caregiver's ill. So a lot of times when they come to the Pickering House, our staff work really hard just to make sure that they have what they need. I talked yesterday to some staff, and we have done things at the Pickering House. We've had weddings. We've had impromptu weddings. We have lots of pets that come in at the end of life. We've had lots of families that we've helped come in to just say their goodbyes and be there, and so they don't have to be caregivers. They can be family and just have that special time.
And I think it took me a while to kind of get on what Fairhope was, which is a great name to begin with, but Fairhope has a meaning.
It does.
And it is?
So, if you look at the word Fairhope, Fair is for Fairfield, HO is for Hocking.
Capital H.
And PE is for Perry County. So that's how that name originated, because we started to service those counties. We've branched out a little bit since then, so but the name remains the same.
Sure. Kristin Glasure, who is the CEO of Fairhope Hospice, the Fairfield, Hocking, and Perry County aspect of that. Not so recently, I won't say recently, but in the last few years, the Anita Turner Center has come online. That's just across. You can see it from your front door up there off the Sells Road, and it's turned out to be just a tremendous asset to your overall picture.
It is. The Anita M. Turner family donates some money to help us get that building built. And up there on Sells Road where the Pickering House is, people don't know that we have 38 acres there. And it's funny because I took a walk back there last week. I really wanted to see. And so we have a beautiful shelter house. We have a waterfall and trails, and it's just really a special place. But that Anita M. Turner Center, the idea behind that was for our grief team, for our bereavement team. We follow families after they've lost a loved one for 13 months. Sometimes, and I don't think we all think about this, but sometimes it's hard for them to walk back into that Pickering House that first time. So the idea behind the Anita M. Turner Center is that's a beautiful setting for people to go get grief support. All those rooms in the back face the woods. There's deer, there's tree, it's beautiful. So they don't have to go back into that place, the Pickering House. The Pickering House served its purpose for them, but now as they're trying to heal, it becomes difficult sometimes.
I would imagine, too, and I see this in other fields, not only in yours, but in other fields, that somebody who has had to utilize your service, whether it's for a friend or a family member, and they've become, let's say, more of a family member, and they've gone through something with somebody up there and they do it, I would imagine that I would think that you've had lots of folks, either as volunteers or perhaps employees, that have come from that area. They saw how their family member was treated, and they'd say, I'd like to get involved in that a little bit. Would you say that's fair?
That is absolutely true. And, our employees that we have at Fairhope, I think a lot of people think this, but our employees truly have a really special heart.
Yeah.
The job that they do every day, you have one chance to do it right. and they focus on that. So we see a lot of staff that come in and say, you know what, you took care of my mom or my dad or my family, and I want to give back, and I know that I have that hospice heart to be here. We also see a lot of volunteers that's exactly why they come back.
Yeah.
Now, they'll take a while to grieve. Sometimes they'll take a year, months, but they'll come back and say, I'm ready.
I guess I've heard this. You have respite care
We do.
available too, and how does that work?
We do. So at the Pickering House, we are able, Medicare allows us to have patients at the Pickering House for up to 5 days for respite care. So what respite is, if you think about it, and for those of your listeners who have really had to care for somebody, that's a tough job.
I don't think people, if you haven't had to do it, knows how difficult that job is.
No. It's 24/7, and so they become tired, they're fatigued, maybe they just need to go see their physician, go to the grocery store. Maybe they just want to sleep for a little bit, So what we do is we arrange for those patients to come to the Pickering House. They can come and they can stay for 5 nights. There's no charge to them for that, okay? That's a benefit. That's a benefit of their hospice benefit. They can come and they'll stay. That gives that caregiver a time to kind of rejuvenate, and it allows them to continue to take care of them. And we can do that up to monthly.
And we talked a lot about going, if you're in the Pickering House out there off of Sells Road, that's one thing. But we didn't talk a lot about, certainly in-home care is a huge part of your service.
It's a huge part. Every patient that we service, if they're in their home, they're going to be assigned a specific nurse, case manager. They're going to have a social worker, a chaplain, an aide if they need an aide to come in and help them with bathing, light housekeeping. And the other thing I think that people don't understand is we're available 24 hours a day, 7 days a week. In the middle of the night, you're looking at your loved one and something just isn't right, and you need that emotional support. You want a nurse to look at them. You pick up the phone, you call, and we send a nurse.
Well, and I think I mentioned this when you were with us a couple of weeks ago downtown. I can't think of one story I ever heard that's been negative.
Thank you.
With Fairhope Hospice. Your folks work so hard, they work so seamlessly. Jobs just, somebody comes in, somebody goes out. There's always moving parts up there, but the people you have, I know it's a tremendous amount of training. You just don't say, well, I want to work for hospice. Okay, you begin tomorrow. It's not fast food. A lot of training goes in, and ongoing training to make sure you have the right people.
Mm-hmm. We have monthly training, as a lot of facilities do, but ours is a lot of hands-on. I've never worked for a place where we provide so much training on the front end. Sometimes, up to 3 months where they're shadowing. They get to, when we hire a new employee, they go out and they will shadow every discipline. They're going to follow a nurse, a social worker, a chaplain, because we think it's important for them to see what their team does. Every person's job is vital to our success of taking care of our patients.
Well, Fairhope Hospice is, again, one of the, I think, shining lights in Lancaster and Fairfield County. Kristin Glasure is the CEO. You do such a wonderful job. We're just very fortunate to have you here in Lancaster.
Thank you.
But you serve Fairfield, Hocking, and Perry County. So best of luck as that continues, and we'll certainly have you and probably some of your great staff back to talk about it. Fairhope Hospice, just a wonderful organization.
Thank you.
Kristin Glasure, CEO, thank you for joining us.
Thank you so much for having me.
Sure. We'll be back on Fairfield Today in just a moment.
Life is unpredictable. That's why estate planning is important. Estate planning provides you comfort and peace of mind knowing that you're taking care of your loved ones and ensuring your legacy lives on just as you envisioned. You lived a life that is beautifully and uniquely yours. You deserve an estate planning attorney who understands that and creates a plan as unique as you and in the best interest of your loved ones. You deserve the local, trusted, experienced attorneys at Dagger Law.
Fairfield Federal. When it comes to our customers and our community, we go above and beyond to help. Our people make the difference.
We were retiring from Tucson, Arizona, and we made a retirement trip out around Ohio, having decided that's where we wanted to be. And we came across this town called Lancaster, and we fell in love with the downtown area, where the fountain is, and the memorials, and the flags, and all this stuff. And we looked around and I said, there's our bank right there.
there's something to be said about a community bank in your hometown.
Right. If you live in the community, you should do business in the community as much as possible. So it makes sense to bank with a community bank where you live.
Fairfield Federal is the bank to be at. If you live in this town, or any town actually, you want to bank at a local home bank. And the employees are happy here, they're conversant, customer service is through the roof. There's nothing more you could ask for.
Personal or business banking, whatever you need, we take it seriously because we know you do. Stop by today at any of our 3 locations and see why the difference is clear. Fairfield Federal Savings and Loan specializes in banking that revolves around you.
Member FDIC, Equal Housing Lender.
Welcome back to Fairfield Today. I want to thank Kristin Glasure from Fairhope Hospice for joining us today. Always fun to talk about hospice things. She is so knowledgeable and really a great partner and a great person and a great business to have in Lancaster and Fairfield County. Switch gears a little bit now. I think when I set up with Joe Ebel, the Fairfield County Health Commissioner, to have him on, it's been several weeks ago. You have to get in early to get him scheduled. He leads a busy life right now. I don't think we knew where we would be in this whole COVID situation, or how it would kind of ramp up in the last few weeks, but it is what it is, and here where we are. First of all, Joe, thanks for joining us. I know your life is pretty hectic these days, as it was a couple months ago when we talked.
That's right.
Kind of ramped down a little bit and maybe got a little chance to take your breath for a month or so there?
Yeah, we really thought we were in a good position back in June. We were seeing, single-digit cases, and but that unfortunately didn't last long.
So as we look, and the word of the day now is Delta variant. That's what we're all talking about now. So do we see that as, I think I'd heard, and you're the expert here, that variant compared to the regular COVID that we had previously was much more transmissible but less deadly. Is that accurate or not?
Well, I think it's more transmissible. I don't know that it's less deadly. I think the benefit we have right now is that a lot of our more vulnerable population are fully vaccinated, so we're not seeing the numbers of deaths that we did when there was no vaccine available.
So if this had hit early on, we might have seen a much worse scenario like we did first time around.
Exactly. It would have amplified what we saw last year.
So I don't know where we are in the state now in terms of vaccination. Maybe it's around 48%, somewhere in there.
Yeah, I think in Fairfield County we're at a little over 48% that have had at least the one dose.
Okay. I'm sure you wish it was much more than that.
Yeah, I think we really saw the numbers drop as the cases started to drop and people thought, it was kind of going away. But the good news is we have seen that rebound. Last couple of weeks, we've seen over 1,000 people start their vaccines during each week. So that, if we can continue that momentum and get people vaccinated, that'll, help us continue to hopefully be in a good position when we do get into the normal flu season, which is, in late fall and early winter.
Mm-hmm. So pretty much out of the 88 counties, pretty much the entire state, with maybe a couple county exceptions, is back in the red. I suppose this is your worst fear, to see everything kind of jump up like this again, and maybe we're back to where we were several months ago.
Right. Yeah, we really felt like we were in a good position in June when we were seeing very few cases, and then I think everybody wanted to get back to normal, and the mask mandate went away, and right after the 4th of July, we saw the first increase where people all came together, and then we saw a spread, and that just kind of continued through the summer. And now with the Delta variant coming in, it's really taken off.
I guess with this new Delta variant coming in, it's pretty much all hands on deck. The health department again kind of maybe had a little break, You do so many things at the health department, not just this, but that's the one thing we recognize, I think, from a public standpoint, we see you do. You've done some other things, but now you don't have when I got my vaccine and my wife got her vaccine, when she got hers first, it was at the fairgrounds. You had that going, and then by the time she had her second shot, you had your place open in the mall. Those places still up and going now?
Now we've brought all that back to the health department offices on Sheridan Drive. And we're also currently doing our back to school normal vaccines for children, because a lot of those fell behind during COVID. So we're doing both, COVID vaccines for adults and anyone who's 12 and over, and doing all those normal back to school things.
So if someone is still interested in getting either their first, well, it'd be their first shot, I guess, how do they do that in your office? How do they kind of prepare themselves to get that vaccination?
They can call and make an appointment, or they can just walk in to our offices any time, pretty much between 8 and 4. Just yesterday, we looked to see how many providers there were in the county that were offering COVID-19 vaccines right now, and we came up with 25 different locations that people can go to. So it's we like to see them at the health department, but we'd like to see them go anywhere and get that vaccine, whatever's convenient for them, including their healthcare provider.
So for so many months, we talked about COVID, then we had a little lull, not a real break, but just a lull. Things slowed down a little bit, and now the Delta variant has moved in and kind of captured all of our imagination again. As you look at this, can you use a crystal ball in some way? Where do you think we're heading with this now?
Well, my hope is that, even though we're fairly high, maybe we won't see that big peak right now. But I would expect us to see that peak as we get into November and December and January, where we would usually see those respiratory illnesses like the flu flare up every year. So I think now it's kind of an anomaly that it's most people are still outdoors a lot and things, but as everyone starts getting indoors and spending a lot more time in close quarters and the kids go back to school, we're probably going to see more and more cases. Now,
I know the governor, at least in Ohio, he has not mandated any masks for school people. He's given all the schools their own ability to recommend that. So do you see most schools around in Fairfield County are requiring masks of students while they're in class?
I think most of them have gone to just recommending, or it's an optional. I think Pickerington Schools is requiring masks. They should be required on school buses, but that's going to be up to the schools and the parents and everyone to kind of self-police that. And that's probably the time where they're in the most condensed area. There's especially elementary kids, there might be 2 or 3 kids on one little bench seat.
Sure.
You can't really maintain that social distancing. So I think that's really important for those kids on the bus, if they're not vaccinated, to be wearing a mask. And then during the school day, they may be able to separate out a little bit more.
Do you think all this vaccination, because that's been the word of the day now for a year and a half, do you think that will have any effect as we move into what would normally be just a regular flu season? Do you think more people will be apt to get a flu shot that maybe didn't in the past? Do you think that'll have any effect?
I know last year we really recommended that you get the flu shot, even before the COVID vaccine was available, because, there wasn't any reason to believe the flu wouldn't circulate as well. So we got, 2 respiratory diseases going at the same time. And healthcare facilities don't need people in there with the flu while they're already being overloaded with COVID cases. Fortunately, last year, I think because of all the precautions we were taking with masking and things,
distancing,
the actual number of flu cases was really very, very low.
That was probably one of the good things to come out of all this.
Yeah, it really did show that you can prevent those respiratory diseases by doing things like social distancing and wearing masks and hand washing that we just normally don't pay that much attention to during a normal flu season.
Joe Ebel is with me. Joe is the Fairfield County Health Commissioner, and I know it's hard to imagine, but your office does a lot more than just COVID chat, because that's pretty much, well, when we have you on, that's unfortunately what we talk about. The couple times we've had you and your predecessor on, that was always what we chatted about. But your office does a lot of other things, and are you still able to keep up with everything else? You only have so many people to do everything.
Yeah, we were fortunate, once we got over a lot of the mass vaccination work and that kind of went down to something more manageable, that we were able to really focus on trying to recover from the pandemic a little bit. So our environmental health division, getting out doing inspections, some of those were put on hold because we didn't want to go into businesses and things unnecessarily. So we're really trying to get that caught up. Our WIC program, those clients that would come in normally for nutrition counseling, we're doing that over the phone. Looking forward to, we're hoping to bring them back, but now we're kind of back on a delay again. We've started up our health education division, trying to work on really that, health promotion, disease prevention, which really I think is the priority of public health. It's preventing people from getting sick, where the healthcare system deals with people once they're already ill. So trying to refocus on that and hopefully get back to normal at some point. But we've certainly spent an awful lot of time on COVID, and it's kind of built that resiliency in the department. So next time there isn't any other type of public health emergency, we're hopefully better prepared to respond as well.
We've recently had the Sweet Corn Festival go on. We've got the fair coming up here in just a short period of time, couple of months here at the fairgrounds. These are outside exercises for the most part. There are some obviously inside moments with that, especially with the fair. Lots of stuff inside there. But the fair at this point, at least, is full open again. All the kids, where last year it was pretty much all the kids, the animals, and that was it, nothing else. Now this year, as of now, we certainly know things could change, but Jim Marcinko and the board down there, it's a full go fair. It's no mask. If you wanted to wear a mask, I'm sure you could. You think it has an opportunity to change? You just think we're going to be good in the immediate future in that area?
Yeah, I think you have to make decisions based on what's currently happening. So it's a little early to tell where we'll be. Right now we're in that kind of red, high transmission category. So certainly, to take that into consideration. If you're outside at an event, it's not that big of an issue. But if you're really going to a concert or sitting in the grandstands and you're packed in, or going to football games and you're packed in, then probably should be wearing a mask in those situations. So just kind of making those judgments, and definitely if you're unvaccinated, the first thing is to get vaccinated. Right now, we're seeing high cases, but we're fortunately not seeing a lot of hospitalizations.
Yes.
So that I think is where the vaccine is really making a big difference right now.
We see the Delta variant, and that's what we talk about now. You think there's going to be other things like that coming out there? Are we in for a long haul of just COVID-related conditions for the immediate, maybe the long-term future?
Yeah, unfortunately, the longer that we have a large unvaccinated pool of people, the more opportunity that virus has to mutate over time, and once it becomes more effective, that becomes the one that spreads more easily.
Yeah.
So as long as we maintain a large pool, and don't kind of reach that herd immunity we were shooting for, I think we're going to continue to see variants. And then you add on top of that, you've got the entire world, where there's countries that are at different levels, and most of these variants so far have been coming from other parts of the world and find their way to the United States.
So I guess the word from the Fairfield County Health Department is, if you don't have the vaccination, get it.
Yeah, you still have, there's 3 vaccines that you can choose from, and 12 and over, it's available for everyone. I certainly would expect within the next month or two that we'd see that age drop down below 12 a little bit. Right now, our cases that we're seeing about 30 new cases every day, and about a third of our cases are kids that are 18 and under. So those kids that are 12 and under, if we can get them vaccinated, that'll help make a dent, and hopefully help protect those kids that are younger and aren't eligible for the vaccine yet.
Well, it's all about the science and not misinformation. myfdh.org, that's a website. It's a tremendous website, lots of great information on there. myfdh.org. Got everybody on the staff there talking about things that are going on with that. So thanks for everything you and your staff and your department's doing out there. You've had just a tremendous impact on the county. Thanks for all you've done for the last couple of years. We appreciate it very much.
Nope, thank you.
Joe Ebel, Fairfield County Health Commissioner, thank you for joining us for Fairfield Today.
Interface Video, in cooperation with Fairfield Federal, presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fairhope Hospice and Palliative Care, the Frankie Smith Funeral Home, Fairfield County Adam H., Dagger Law, and the Fairfield County Board of Developmental Disabilities.